My name is Laura Broster and I'm Director of Communications and Public Insight for Dudley Clinical Commissioning Group. Key to the success of any new way of working is that people understand why that service change is required and what it will mean to them. You can only get to that point if you really understand what's important to individuals. That's our stakeholders, the staff and the people who are going to be ultimately using these services in Dudley. Our new model of care in Dudley has been designed around the views of local people and those using the services. And we already knew that people across Dudley wanted improved access to primary and community services. We also know from our focus groups that people with long-term conditions wanted continuity of care. They wanted to see the same person who understood their condition and had access to information about them and what's important to them. And we know from many of the complaints that we receive that unfortunately, when people are frail and vulnerable, that our services were not always meeting their needs in terms of effective coordination of care, particularly at the end of life and for those who are most frail. So we knew that that was something we needed to improve on. Our model of care has been designed around the principles of improving access, continuity and coordination for the people living in Dudley, and that makes the message much easier to communicate in terms of how this new model of care will have a positive impact on them. So the new model of care in Dudley has been shaped based on the feedback from local people. It has been developed through the involvement of local people, and the procurement has been influenced by local people as well. And what's really important is that the new MCP in its contractual form places a bigger emphasis and more importance on the views of individuals, on the outcomes and their experiences of using the new services and how it benefits them. My advice to others when embarking on a large service change like the development of Dudley MCP is to be brave. Don't wait until you've got all of the answers before you go out and seek people's views. That's sometimes really hard to do because people do expect us to be in a position of knowledge. However, if we trust that people using services and those who work within it will have some of the answers to the questions that we haven't even thought of yet, then we'll end up with a much better outcome. I'd also say be innovative. Take the conversations to people. Don't expect them to come to you. In Dudley we hired a camper van and we went out round the parks and took the activities to engage children whilst their parents expressed their views on our new service model, and that worked really well. And I'd also say be ready to listen. We often say that we're ready to listen, but then we're not prepared to make changes. And very early on in the development of Dudley MCP, we made a number of changes to the way that we were engaging with people so that we could better appreciate and understand their views. So one of the biggest things I've learned is that you cannot expect people to be part of the solution to the problems, to be involved in their own care and how they look after themselves if you don't involve them actively in the development of that system of care. So be brave, be innovative, be prepared to listen to their views, and you will find the solutions in the things that they say.